Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
All right, welcome back. This is the Healthy Living edition of KOM News Extra. And once again, please join me in welcoming Dr. Jikta Lom from Express Care. She's in studio tonight, as she is every Tuesday, taking your questions regarding a variety of topics. And tonight, we're tackling the very controversial and very sensitive issue of alcohol and the side effects of it. All right, Doctor, welcome back.
Thank you.
All right, how have you been?
Very well, thanks.
All right, well, we're very happy to have you here again. Of course, discussing alcohol on Guam, it's always a perpetual concern for Guam. Marketing research shows that Guam consumes a great deal of alcohol and everything. So certainly for people in your profession, dealing with it and helping control that, very important.
Yes, I agree with you.
Okay, so a bunch of questions to get to. We will have the viewer questions which you post to us on our Facebook page coming up, but let's talk about some of the preliminaries. So what effect does heavy drinking have on the human system, and like consuming either mass quantities of alcohol in short periods of time, or over a long period of time?
Right. Well, alcohol can affect absolutely every organ in your body. Specifically for the immune system, there are some serious nutritional deficiencies that can result as a result of alcohol abuse or overuse over the years. Zinc, magnesium, the B vitamins drop down, and your immune system is not as strong because the white blood cells become affected. They cannot fight infection as well. So people who drink a lot of alcohol will tend to have more boils, more sores, more infections, pneumonia. And in addition, the immune system doesn't fight the cancer, precancerous cells as well either. So alcoholics will tend to end up with more cancers also.
Is gout necessarily a byproduct of mass alcohol consumption? Because I know a couple people that have gout that drink a lot.
They do. Beer in general tends to be the culprit there. Other forms of alcohol tend not to bother quite as much, but beer can definitely aggravate gout.
Okay, now some of the, like one of the things we like to do here when we're talking to you is like some of the urban myths that we talk about. Does drinking alcohol necessarily kill brain cells? I know that's, people always talk about that,
Well, I think it does impair brain function for sure. Killing them, I'm not sure if it kills them, but over time, the brains of alcoholics will shrink. So if autopsy is done on a person who drank heavily, their brain is smaller, the cells are shriveled compared to a person who doesn't drink heavily.
Okay, so we talk about psoriasis, and it of course affects the liver and everything. How does drinking alcohol, contribute to psoriasis, and what does it do to the liver? We just talked about the brain, you've talked about the other immune system and everything. Specifically to the liver, what does it do?
Right. So alcohol is a toxin. It's processed through the liver just as many other toxins are, and it's very irritating to the liver. There are enzymes in the liver that convert alcohol gradually actually into vinegar to process it into something that can be handled by the body. So large quantities of alcohol will irritate the liver, cause inflammation, destroy liver cells, and the liver can regenerate little by little, but only to a point. So the initial injury is inflammation, swelling of the liver, and then gradual destruction and scarring. And cirrhosis is the end result, where the liver has basically become an organ of scar tissue, and it cannot function very well at all.
Okay, now what does it mean when people say alcohol has a biphasic effect on your body, and what exactly is that?
Well, the reason people drink alcohol is because it gives them pleasure, at the beginning anyway. 1 or 2 drinks will raise your blood alcohol level to a point where people will have a sense of relaxation or a small buzz or feel joyful or maybe a little bit less inhibited than they might be normally and be able to enjoy themselves. Past that, when the blood alcohol level sort of reaches a higher level over, let's say, the legal drinking limit, on a breathalyzer, you start to get impairment and depression of the brain, especially difficulty with reflexes, and disinhibition to the point where people can become very aggressive and belligerent. So the first part, enjoyment; the next part, belligerence, aggression, and confusion, lapsing on into more serious conditions like actually going into a coma from alcohol.
Okay, well, stay tuned, because we'll come back after this commercial break and we'll talk about some of the viewer questions we have. So once again, drinking alcohol may or may not necessarily contribute to gout.
It may.
Okay. All right, well, stay tuned. We will be back with much more show right after this.